Hello everyone. In this week you are going to learn about first aid. First aid is the basic knowledge about treating or attending any injured person or any patient who might develop some emergency. So, it is very much important to learn about first aid. Even your palliative care patient may need first aid sometime, if he falls from his bed in your hospice, or if he comes across some cuts and wound because of some injury, then you also need this knowledge about first aid. At any moment you or someone around you could experience an injury or illness, and using basic knowledge of the first aid you are able to avoid a big mishap and you are able to support this person. That is why it is so important to learn basic aid first aid skills, and to build on information you learn here considering taking a first aid course. So, this is only a basic knowledge we are giving in these lectures, but it is not a course. To take up a course you have to approach some institution and you can take up a first aid course and get a certificate, but this is the basic knowledge about the first aid is given in this lecture. Many organizations offer this type of training, which includes Indian Red Cross Society or St. John of Ambulance. The coming to definition of first aid, when you provide basic medical care to someone experiencing a sudden injury or illness, it is called first aid. The term first appeared in 1878. In some cases, first aid consists of the initial support, and this support is provided till the medical team reaches to the scene and gives the support to the patient or shifts the patient to hospital, and this support may help them survive until the proper professional help comes. In other cases, first aid consists of care provided to someone with minor injury, sometimes at home, like minor cuts, burns. You must be remembering that as a child when you fell down from by riding a bicycle, your mother provided first aid. She cleaned the wound, she applied some Dettol and then some ointment and gave a bandage. That is the first aid. Or suppose you are in a garden and some insect sting has occurred and you are given first aid. A simple definition, there are many answers to the question what is first aid, and here are a range of definition for your interest. First definition is emergency care or treatment given to a ill or injured person before the regular medical team arrives or obtained. Second is first aid is a emergency care given immediately to an injured person. The purpose of the first aid is to minimize the injury and future disability. Third definition is first aid is a simple medical treatment given as soon as possible to a person who is injured or who becomes suddenly ill, like a person develops suddenly traveling in a bus develops vomiting. First of all, you make the bus stop nearby and make the patient go down, clean his mouth and other things, and give him some water to drink and give some medicine whatever you have for the vomiting, and that is what first aid is. Definition 4 is the initial process of assessing and addressing the needs of someone who has been injured or in physiological distress. Our definition here is these are all fine and give sense of first aid in all about, but we tend to say first aid is immediate temporary care for ill and injured. Remember, it is a temporary care till the medical other professional help comes. So, it is a temporary care given to a person who has undergone an injury or who has fallen sick. Which are the types of first aid emergencies? We also always explain the first aid has 3 priorities. First is preserve life. In this, the person is dying, maybe his heart has stopped and you give CPR, cardiopulmonary resuscitation, in providing airway, breathing and circulation. that is preserving life. Second is prevent further worsening, like stop the casualty from getting any worse by treating their injury. Also managing the incidents to prevent the situation worsening, like patient who has fall down trap into a burning house. First of all you bring him out, so prevent further burns on his body. Third is promote recovery. Try to help a person feel better by talking to them and supporting them emotionally. Suppose a person has undergone a vehicle accident, he is conscious, maybe his leg is broken, but he is conscious talking to you. You go and talk to him, providing him support till the medical emergency help comes in. That is what promote recovery or supporting a injured person. 3 steps for emergency situation. If you encounter an emergency situation, follow these 3 basic steps. Check the scene for degree. Look anything that might be dangerous, like fire, falling debris or violent people. Then you take your person or a client to a safer place and remove his exposure from further danger. If the scene is safe, assess the condition of the sick and injured person, how bad it is, where he is injured, whether there is a bleeding or not, and whether he is conscious and all such thing, and do not move them unless you must do so to protect them from the danger. Second step is call for the medical help. If you have somebody along, tell him to call police or call a emergency ambulance or call a hospital nearby. Third is providing care. After that, first by assessing, by calling a help, then you provide care, and this care you provide as per the injury or illness suffered by the patient. So, you remain with the patient first of all, try to assess what the situation is, where is the injury, how bad it is, whether he is in pain, whether his pulse and all, he is conscious, he is talking and all such thing, then keep providing care till the medical help comes in. Remove yourself from danger if at any point situation you think it is unsafe for yourself. See your safety also. Suppose the injured person is among the mob and everybody is attacking on him, then remove the person along with yourself. If you cannot remove the victim, at least remove yourself. You do not get exposed to this type of beating or any attack by other mob. So, protect yourself, that is also one of the very important step of the first aid. First aid bandage. You should learn how to apply first aid bandage. In many cases, you can use an adhesive bandage to cover minor cuts, like small cuts and wound, you can apply bandage. To cover the protect larger wound, you might need to apply a clean gauze pad or roller bandage. To apply a roller bandage to wound, follow these steps. Hold the first of all, whenever you want to apply a bandage, hold the injured area steady and keep it separate from other parts. Gently but firmly wrap the bandage around the injured limb or a body part, cover the wound. Fasten with the sticking tape or with the safety pin. The bandage should be wrapped firmly enough to stay put, but not too tightly. It should be wrapped properly, not too tight, not too loose. Too tight will cause obstruction to the circulation, to the blood flow, and too loose will not serve the purpose. To check the circulation in a bandaged limb, pinch one of the person's fingernail and toenail and check for the color by pressing the that particular nail on that area. You change for the color. If there is a circulation, the nail will become pink. Second is first aid for the burns. If you suspect that someone has third degree burn, call 911 and seek professional medical care for any burn. When it is large area of the skin is involved, call the medical help. Or located on the face or groin or buttock, which are the vital areas, and then also call the help. have been caused by the contact with the chemicals or electricity, then you cannot manage without the help of the expert. To treat a minor burn, run cold water over the affected area for up to 15 minutes. If that is not possible, apply a cool compress to the area instead and avoid applying ice to the burnt tissue. Do not apply ice directly, only the water. Over the counter pain relieving medicine will be helpful to the patient, but if the victim gives history of any allergy to pain medicine, first you inquire about it and then only give pain medicine. There is a lidocaine ointment is available or some aloe vera ointment which has got a soothing effect, it can be applied over the burns. To help prevent infection, apply an antibiotic ointment also and loosely cover the burn with clean gauze piece and find out where to call the doctor and where to send the patient, refer the patient for further treatment. Then first aid CPR. Suppose a patient has fall unconscious and his heart has stopped beating. In this case, you have to give CPR. There are number of trainings are available on CPR and advanced life support. One can undergo such training, but if primarily you can help the patient by securing airway, giving breathing and by securing circulation. So, if you see someone collapse or find someone unconscious, call 911. If the area around the unconscious person seems safe, approach them and begin CPR. First of all, the area should be safe, victim should be shifted to the safer area if required. And if you do not have formal training, you can use hands only CPR. If you are not certificate or not formally trained, there is a one method of giving chest compression which we call it hands only CPR. You will learn about this in detail in next few lectures. And place both the hands on the center of the chest of the victim and one hand on the top of the other and start pushing, compressing the chest below. And you have to compress to about 1.5 to 2 inches below and then bring it above. And this compression is given about 100 to 120 times per minute. Compressing the chest to the beat of Staying Alive by the Bee Gees and Crazy in Love by can help you count at the correct rate. Continue performing chest compression until the professional help arrives. First aid for bee sting. When you are on hiking or some trips to the mountains, you are likely to get this type of victims. For some people, a bee sting is a medical emergency, and if they have an epinephrine auto injector, there is a pre-filled syringe of epinephrine, this bee sting will cause anaphylaxis or very severe reaction to the patient, where patient will have all rashes all over body, edema all over body and choking sensation in the throat. And by giving epinephrine, you can remove this sensation and survive the patient. Someone who is stung by bee and showing no signs of allergy reaction can usually be treated without professional help. If the stinger is still stuck under the skin, gently scrape a credit card or other flat object across their skin to remove it. Try to remove that insect which is still stricken under the skin. Then wash the area with soap and water. So, this will clean up the poison deposited by the sting and up to the 10 minutes and to reduce the pain and swelling. To treat itching or pain from the sting, consider applying calamine lotion or paste of baking soda and water to area several times a day. First aid for nose bleeding. This you might have come across in small children sometimes, or even elderly people who has got blood pressure, they do not check their blood pressure and got continuous hypertension, they are likely to bleed. Then very older people, they have very fragile mucosa in the nostril and by scraping they are likely to bleed. So, sit down and lean their head forward, make them look forward Using the thumb and index finger, firmly press or pinch the nostrils and close the nostrils. Continue to, firstly you apply pressure over the nostril continuously for 5 minutes and check and repeat until the bleeding stops. If you have nostril or of vinyl gloves, you can put or pinch their nostril close for them. If the nosebleed continues for 20 minutes or longer, seek emergency medical care, or you can even pack the nostril lightly with the gauze, or slightly firmly patient can start breathing from the mouth and pack the nostril till the medical help arrives. First aid for heat stroke. This is very common in India because all our many states has got a very bad summer and heat stroke is very likely. When your body overheats, it can cause heat exhaustion. If left untreated, heat exhaustion can lead to heat stroke. This is a potentially life-threatening condition and medical emergency. If someone is overheated, encourage them to rest in a cool location. Shift the patient into cool location inside a house, under a tree and all. Remove excess layers of the clothing and try to cool down the body and loosen the clothes to get the air inside the touching the body. Cover them with cool damp sheet and apply a cool wet towel to the back or the neck and sponge them with cool water. Then they may have nausea, vomiting, mental confusion, fainting, seizures or a fever also. So, cool the skin as much as possible by repeated cold sponging. If patient is able to drink water, give him cold water to drink, plenty of water, ORS, that is oral rehydration solution, on lemon juice and all that. And if they are not vomiting or unconscious, encourage them to sip cold water or a sports drink. These are the primary aids given before the patient is shifted, victim is shifted to the hospital. First aid for heart attack. First of all, emergency ambulance services. If patient is already taking nitroglycerin or he might be having a strip of nitroglycerin tablet at home, then tell them to take that, put the this medicine under his tongue and cover them with a blanket and make them lie supine as far as possible. And if there is a difficulty in breathing and you feel that his heart has stopped breathing, then you can start CPR and before they lose the consciousness. So, give nitroglycerin, give comfortable position, call 108 ambulance and then shift the patient. First aid kit list. You never know when you might need to provide basic first aid. So, you prepare yourself by preparing a kit for yourself. As per your knowledge and as per your expertise, you can prepare this kit and this kit can be kept in your vehicle or along with you whenever you are traveling or you are out of the house, or at house also this kit can be kept ready. Because at home also so many emergencies occur, injury may occur and you might need your kit to help this victim. You can buy pre-assembled first aid kit from many first aid organization and which may include some medicine, some bandages and so many other things which we will come to know in next slides. So, the kit should include a adhesive bandage of assorted size, various size of bandages, roller bandage, absorbent compress dressing, sterile gauze pad, adhesive cloth tap, triangular bandages, antiseptic wipes, aspirin, acetaminophen or that is a paracetamol or brufen or antibiotic ointment. Sometimes steroid cream, calamine lotion, nitrile or vinyl gloves, safety pins, scissors, tweeters, thermometer, breathing barrier, instant cold pack. Breathing barrier is given for used for the CPR for giving breathing to the patient. Then blanket, first aid manual. So, as per your expertise and knowledge you can prepare your kit. First of all, important to protect yourself. Suppose patient is, you come to know this patient is having pneumonia or some infection, or in even skin infection he is having. So, then you protect yourself by universal precaution, by wearing gloves, mask, if possible gown and all such thing. And so, always do not expose yourself to any chemical hazards or any injuries or even any infection. Always avoid direct contact with the blood, vomit or any body fluids, because you do not know the status of the patient. Suppose patient may be having HIV, then if your hands has some cuts or injury, and if you expose them to the blood and vomitus of the patient, you are likely to get the infection. So, wear the protective equipment whenever whatever is possible. Secondly, after attending the victim, you wash your hands with soap and water immediately after providing first aid. In many cases, basic first aid can help stop a minor situation from getting worse. In the case of medical emergency, first aid even might save a life. Suppose if you know CPR thoroughly, then you might save a life. Later on, after shifting the patient to the with the medical professional or to the hospital, you can follow them up and you will come to know how your first aid has helped this patient to survive or make him less vulnerable or less injury afterwards. This is the reference from which all this material is taken up. Coming to part 2, you will have to learn about first aid acronym, few words you will have to learn in detail and to gain a proper knowledge. This first, like CPR, it is important to remember what is CPR, and it will help us remember key action and information in first aid setting. If you are already begun your first aid training, you are probably come across several of these, and if you repeatedly read that, you will memorize it and you will be able to practice it better. These are the common acronym, starting with AED, that is automated external defibrillator, which is commonly used for the advanced CPR and resuscitation. ALS means advanced life support. ABPU means alert, voice, pain and unresponsive, whether patient is alert, whether patient is able to talk, whether patient is pain, and U means patient is not responding to your verbal command. Basic life support, it is a CPR is basically BLS and ALS, basic life support and advanced life support. So, you remember this, BLS is basic life support, BP is blood pressure, community first responder, that is CFR. If you are one from the community, then you are called community first responder. So, maybe in your locality you may be knowing the name of this community first responder. So, if any emergency occurs, you can call CFR and take his help. CPR is cardiopulmonary resuscitation. DNRs do not resuscitate. Certain patients who are with advanced stage of disease or having highly infectious and having too many problems may not require resuscitation and may be shifted to the professional institution immediately. DR ABCD, this is a word you will learn during the CPR training. DR is danger, what is there any danger, what is the response, and then comes the airway, breathing, circulation and defibrillation. DVT is deep vein thrombosis, where the blood vessels of the lower limbs or upper limbs, they get thrombosed, they get blocked because of the blood clot. ECP is emergency care practitioner and EMT is emergency medical technician. FAST, face, arms, speech and time. GCS, Glasgow Coma Scale, this is very advanced thing to learn, but if you are very expert, you can learn about this, the type of coma patient victim is and what is the grade of that coma, that you can learn by this Glasgow Coma Scale. Glyceryl trinitrate, It is a medication used for chest pain, that is our sorbitrate. It is known for the angina, and many of the cardiac heart patient will be having the strip of sorbitrate at home. Level of consciousness, you have to define the level of consciousness. So, these are the terminology will be useful when you are talking to your professional. So, before the professional help comes, you are giving first aid, but when professional help arrives, you have to give the summary or whatever is done. And if you know this terminology, it will be very, very useful to describe whatever you have done to the victim. Then myocardial infarction, MI is minor injury unit, no known drug allergy, NKDA. This history is taken from, if victim is conscious, it is taken from the victim, or victim is accompanied by a friend or family member, they can give history. Pupils equal and reacting to the line, pulse, that is a sign of consciousness of a patient. Pressurized metered dose inhaler, that is usually used by asthma patient, and if patient is choking or breathing difficulty, and then he is asthma patient, he might be carrying this inhaler which you can use immediately. So, you should know how to use this inhaler, that is also a part of first aid. Provocation, quality, radiation, region, severity, timing. This PQRST is usually done for the pain assessment. Where is the pain, how it is provoked, what is the quality of the pain, where it is radiating to other part of the body or not, or any other region, and what is the severity and what are the timing of the pain. This is how it is used. PT is for the patient, rest, ice, compression, elevation. SCALD, size, cause, age, location and depth. Acronym is used to assess the severity of the burn, and TB is for the tuberculosis, everyone knows. TIA is transient ischemic attack, when a patient falls unconscious or develops a convulsion or develops a weakness of the limb or lower limb. It is called because of the transient ischemic attack in the brain, and where the circulation stops and patient gets this type of attack. Ventricular fibrillation during resuscitation of the CPR victim. If you see the ECG and there is so many fibrillatory waves, very fast movement of the heart, it is called ventricular fibrillation or ventricular tachycardia. So, always remember, whenever you are giving care to a wounded person, check the wound for impaled object, whether wound has got any impaled object inside. Sometimes it is, you should not remove that object, like a sharp injury with a stab or knife in the neck. If you remove the knife, the whole vessel will get torn and patient may bleed to death. In such cases, you do not remove the object, but if it is a minor object in the wound like a small stone or something, you can remove it and then apply pressure, raise the limb and ensure bandage is effective. The effective bandage by after raising the limb, it is gone. DR ABCD will learn more in during the CPR. So, acronyms are an easy way to remember actions, processes and other information commonly used in first aid. So, we recommend memorizing the acronyms about to boost your first aid skill. This will help you express your procedures and things you have done better to the medical professional, and potential it will help you save the life of the patient. Thank you very much.